personas que nos acompañan hoy. Good morning to all the people that are with us in this work exchange experience. This is the opening address. We are in the ISS. We want to greet you. And I'm going to give the floor to our dear Elena Perez, that is going to talk to us. She's going to be the moderator in this opening address. And please, we'd like to give the floor. Good day, everyone. Thank you so much, Vanessa. Thank you, my peers, men and women, and the public here present, and those that follow us through social networks. Everyone, hello. We would like to give the welcoming formally to this forum about the household work and social security, because for us, this is of great importance, this forum regarding housework and social security, because it's giving under the lead of two of our affiliate, Ms. Casse, that look for most agile and effective mechanisms for the incorporation of homemakers on social security in these three countries that are Brazil and Mexico and Paraguay, as well as of great importance is for Colachao and Assis that are here present. For us, it's a great challenge, and not only for Colatrao, but all the countries in Latin America, to be able to progress in the pertinent analysis to ensure that all of our regions, and in particular how women that work at home, can be included in Social Security, homemakers. This part is very important because if we take into account that according to the regional statistics, only 10% of 18 million women and men homemakers have the right of protection of Social Security. Being this a core value from Colatrao, will continue expecting for organizations such as CARE will continue supporting and will go hand in hand with this initiative. So again, we would like to welcome you and thank you again to all of you, because today we're going to have a panel of different personalities that is very, very important, that for us it's a great pride to have each and every one of them in the day to day. We have Mr. Avalo Velarca, the Secretary General of ASIS, that is going to be with us. We also have as a panelist the Marcelina Bautista, founder and director of CACEH-Nacional in Mexico City. And we'll also have as panelist Ana Maria Mendez, the regional director for Latin America internationally. And we also have Jessica Miranda Pinedo, coordinator of the domestic area. And this is an organization that goes hand in hand with all the work that we organizations do of homemakers. And we also have as a panelist Miss Clara Pinto, Secretary General of FENATRAD and Colatrao, that is the Latin American Confederation and the Caribbean Confederation. Would like to greet you, and we'd like to give the floor to the General Secretary of ASIS, Mr. Álvaro Velázquez Tinalde. Good morning, and to everyone, on behalf of the chairman of the Confederation and of our dear General Secretary Hernandez, and he had some problems outside his control. He was not able to be with us today, but for sure he's going to be with us online. We're very pleased to receive you here in our home in these facilities of the Confederation. I would like to greet all the other people that I share this message. Marcelina Bautista, Director and Foundation of Casa Nacional, Jessica Miranda Pinedo, Coordinator of the Working Area, and who are with us today. And welcome everyone. And we have Arua Mendez, the General Director, and in Caro International, Mr. Pinto, General Secretary of CONATRAB, as well as the moderator, Elena Perez from Conatrao. Now, our campaign, then we have some other people virtually. For me, it's an honor to share this table with you. And a few months back, we had we are all looking at the confederation that is a we have some changes of knowledge. And in effect, today we see that institutions in Paraguay and Mexico, uh, so we have to be in Social Security and also. So we have to look at working relationship in this the microphone. See, if I go far, you cannot hear. Yeah, can you hear me? Yes, we can hear you better if you're far. If you're too close, we cannot hear you well. So after listening to the Paraguay Brazil institutions, we'll have the opportunity of, and one of the things that we like to do in the conference is listen to organizations of people that are workers in this sector that will talk to us about the progress and challenges that prevail in their affiliations and Social Security. These organizations are widely recognized, the ones that are with us, and they fostered international standards. And to some extent, they have been able to implement legal reforms to facilitate affiliation of homemakers to Social Security as well. We have coverage, considerable coverage. There's an estimation, according to the conference, in the Observatory of Progress on Social Security in 2023 in Chile, 42.3% of people in the sector had coverage. In Costa Rica, they were 35.6. In Brazil, we had 35.5, even if the peers said to us that it's only 10%, so we have to check the statistics. In Ecuador, 28.8%. And soon we will give you figures of Paraguay and other countries. And we'd like to invite you to check our platform where you can see this information and from other countries and other indicators as well as we're open to comments and information and complaints and suggestions. And Mexico implemented a program that's adapting to the particularities of this activity and technological progress to expand the coverage. This has allowed to have constant improvements of the coverage from 2019. And then we started having the pilot program of incorporation. And today we're going to talk about it as well as the particular strategies of Paraguay and Brazil. So today we are going, these strategies can be replicated in other countries where efforts do not formalize this activity. And this is a path that is important in the incorporation of other occupations and Social Security, such as the work in digital platforms or other activities where all the characteristics of subordinate work are present. Looking at the declaration of the conference and in the framework of its 80th anniversary in the General Assembly, in order to ensure the universal exercise of right of Social Security, we are going to use strategy of different natures, such as different tools, looking also to ensure that the state part will exercise its authorities for the parties involved, all of them in particular, the buses will assume the responsibility, and you'll have a CISS to find strategies in order to strengthen Social Security to achieve to ensure it becomes universal and in order to promote investigations and other projects to contribute to that. We're at the ready of all the efforts that want the best conditions of the life quality of American people. Thank you for trusting us. Thank you for being here face to face and online. Good day, and we hope you have great success in this forum. Thank you so much, Vanessa, for the kind words. And now we're going to go ahead and we're going to go with Marcelina Bautista, the director and founders of CACEH-Nacional Mexico. Marcelina, thank you so much. Thank you. And thank you, everyone. Elena, soon we'll see you here. And I would like to greet the Conference of the Inter-American Development And so now, we'd like to welcome you to the Inter-American Forum on Social Security and on the different countries. So the National Center for the Professional Development and Leadership of the homemakers is happy to be here, thanks to the support and openness of ASIS and CARE, because we have to share with you knowledge, best practices, and challenges in important topics such as household work and also social protection. We hope this space is a space for learning for everyone, where we can all collaborate, and it's highly enriching for all the work that we will be doing. On our hand, we also have an enormous achievements in Mexico, but important challenges. In the last 23 years, we did not know how far were we going to reach, get to our um, rights of homemakers. Along the way, we built our identity. We recognize our rights among many barriers to exceed Social Security, for example, to have access to Social Security. And in some countries, household work is not regulated in an optimum manner, and therefore it is very difficult for homemakers to have access to their rights. And our peers in Brazil are recording these, or they don't have Social Security only because they have this modality of work. And as employees of our homemakers, thousands in Brazil are not being registered in Social Security and in other topics. Homemakers in different countries in Latin America have wages that are very low. Therefore, it's very difficult, and that makes even more difficult to pay the fees of Social Security. So many of the workers simply want to make the daily wages, and they forget their rights for because the work is highly precarious. Workers at home also present lots of lack of knowledge of their rights because information doesn't get to them in such an easy way. And therefore, they're dedicated to work at home, and many times, and we don't have this information. And many times, we have to give information to them, and so the days they can, but is Sundays. But most of the people, for example, in Mexico, now work on Sundays too, and therefore they don't even can have any training. That's why it is of such importance to invite all homemakers that are also part of so that they also help us spread this information so we can progress in these practices of the rights, human labor rights of women, of household women, or homemakers. Regarding the barriers to be incorporated to Social Security of homemakers, in spite of the fact that the administrative part has improved in IMSS, many times homemakers, they don't have the knowledge, and because they don't have the knowledge also, that many employers think that they don't have rights, and many times they tell them they don't have rights because the law doesn't say so. And so we have to spread the word in the countries, in the bodies that are add to us, to sensitize and visualize this work. So other good practices that have contributed to the incorporation of homemakers, such as, for example, to Social Security or any other type of rights established by law for them in most of the countries in Latin America, laws are special, and therefore workers, household homemakers, didn't have the same rights as the other workers. And now, because Mexico has improved its laws, then female workers have the same right, and homemakers have the same right as any other worker. So the work they do, the organizations do, is very important, and all the work we do is important in order to become allies to reach more homemakers and spread the labor rights and human rights and the work that is also done by organizations nationwide with a trial with feet that by doing awareness campaigns so that workers and the employers can change the culture that we have, thinking that the work we do doesn't deserve any rights, or that homemakers, because they live in the homes where they work, should not have or aspire to have greater benefits. Also, it's very important in other countries, and in particular in Mexico. Mexico has simplified the incorporation of Social Security of household workers. Therefore, we see that these homemakers, as well as employers, don't have the information to enroll these people in Social Security. So, in the other tables, we'll start getting to know all of these challenges, achievements that we have, because we have so many achievements, and all organizations and all institutions that work with us. And we still see the challenges as barriers, and that's why we are going to continue working the best way possible. Therefore, please, let's go ahead with this forum. I wish you the best success. Let's continue progressing, and let's having a good agenda for homemakers. And good day, and thank you so much. Thank you so much, Marcelina. The topic of inclusion and social security for homemakers in Latin America is the same in all the countries. We need to have the progress. We have to see the progress that you've seen in Mexico regarding inclusion and social security. But there's a long way to go. We have to continue working very hard. Internal laws in each of the countries establish some barriers in the system. So, establishing minimum wages for the sector to be able to be included in social security, and this is one of the main problems that we have in our region. And we are going to continue with Miss Ana Maria Mendez, Regional Director from CAN International. And thank you so much. Thank you, my peers. And only with these introductory words, I feel like in Mexico, I feel is highly emblematic, is the headquarters of this forum, because for Latin Americans in general, Mexico has always been the referendum of this labor force, of the power of workers. And still, we know that a lot of work is still important. And this is Ana Maria Mendez. I'm very happy to be here representing all the peers that work in CARE. And many of you will tell you, what does CARE do and why is CARE here? Our commitment has always been and will continue being with equality and justice and economic justice of women. And that places us in a place that is great honorable to join efforts with you to progress in these areas. Is that going to be an innovation that I share with you that in Latin America as well as in the Caribbean, uh, like creating effective mechanism, continues being a very important debt for millions of women that are trapped in this informal sector of the economy, a sector that is not valued because, in spite of the enormous economic contribution that it provides, where we also require collectively and a greater investment and actions to protect these rights that our peers have spoke about, and you'll continue speaking about. The work, yes, but dignified work for homemakers and for caregivers, as well as producers, entrepreneurs, workers that are in the value chain. and those that look for better access to financial inclusion. They make up the four populations of impact of our strategic purposes in CARE with regards to progressing economic justice for these women. With this, we want to fight inequality problems, but let's also see that all of these problems that they have, inequality of gender and differences, racial differences, can amplify having better and economic justice. It's not our ambition, it's just because this shows the minimum respect of our rights, and you're going to say to one another, so Karen, that sounds good, but what does CARE do? Where are we? Since 2016, CARE proposed to itself and was implementing different initiatives under the framework of the regional same values, same rights of CARE in Colombia, Ecuador, Guatemala, Honduras, but also happily in Mexico and Brazil. Because we do not have offices, we have great partners of women that inspire us and motivate us and commit us. And through all of these alliances, we support together with other actors their strategic alliances and agendas. What's important is their voices, their strategies, their fight, the tireless fight for rights and human rights embedded in the international and national standards, many times that have not been observed, including the right of security and social security. And I would like to pause here to remind you that institutions, and tell me how these institutions were born and now we, Social Security institutions, would have to see the light in Latin America. And I believe that even with their deficiencies and even with their challenges, for me, it's one of the most noble institutions that the country can have. And I think that that is why working with them, towards them, and strengthening them is also a commitment that we all have to embrace and continue progressing together. So we want to continue to honoring our commitment, generating these alliances, generating these spaces such as the one that summons us today, so that we are analyzing the problems, and also from these our proposals will emerge from each and every one of the different views in order to build common views, collaboration, and also results. And I feel that we have been working with the reivindication of human rights, and we always are at that, and we always feel what is so important. And Karen considers that the multiplication or scaling of social changes can also happen from these joint efforts of multiplayers, such as a forum we're organizing today together with you, where we have different voices and challenges. Y, uh, so we continue contributing to see the rights of women in homemakers towards their social protection and access to social security. And now the figures are unfair, and we are seeing only those countries that go and progress better. And let's not forget uh, those that don't have and are not doing greater efforts. And this is important. And there's other women in other places that say, yes, we can, and we can continue progressing, and we can amplify this effort. And I know they're doing so, but we know that these are different challenges and important challenges. And I would like to close because the forum is not about CARE, and there's so much that we want to hear all together. Again, going to our commitment to continue building together to listening to you. We have an active listening, and we want to see what is the grain of salt that we can add to your proposals and efforts. And I think that we have a very interesting example how the use of the tools and applications and digital platforms such as an innovative action in these social protection mechanisms can summon other players to the table to find more effective solutions led by homemaker organizations. And this leadership is so important. They are the ones that should lead these efforts, and we are here to follow them. We also know that the these groups of women in Brazil, like THEMIS and the Alliance to the homemakers in Brazil, and today this has been expanding in different countries, looking for this innovation that should allow us to have better access, that should extend access and to spread this access everywhere, because we're going to see how it is possible to speed up and provide access to working women. We are very proud in CARE to be part of these initiatives, and we are highly committed also because we know the important responsibility this commitment has. We are committed to innovate together with you, to co create between the national, local, and regional, to touch and to make an effort to improve the conditions of so that homemakers can have a dignified situation. You can count on CARE. The initiatives are we are closing the digital gaps. That's what we want to say. We're amplifying the options in order to reduce gender inequality that according to CEPAL, 4 out of every 10 women in the region are not even connected. So there we also add another important challenge that I feel we have to continue considering under the framework of this forum, and how can we advance. Even though we have these, we need training of basic skills to be used, and that this hurts more than anything else the force of working women in the formal and informal sector or formalized sector by respecting their rights, such as household workers, where this informality in most of Latin America reached more than 75%, and in some countries, more than 90% of people. And getting closer and appropriation of women in the households regarding technology are also a call, a very important invitation to the international players and the government in order to foster the incorporation, to accelerate public services and social security services, as well as professionalization, training, and certification of the sector, and access to more effective financial products to ensure their inclusion to economic justice. Again, I greet you humbly but with great enthusiasm to see materialize this effort. And we're always quite attentive from CARDE to listen to your initiatives, to listen to your proposals, and renew our commitment with these efforts in this day and in all the time that we could be together. Thank you so much. Great success. And to be part of this forum. And thank you, everyone. And so let's add ourselves and let's commit ourselves. Thank you, Ana Maria Mendez. And I wanted to thank you from Colatrao for all the support that we've received from the different organizations that are part of it, on behalf of CARE, on the support and follow up, as well as all this fight that we have been having throughout this time, and also rescuing the fact that The topic of the digital gap affected us a lot, affected household workers, the topic related to access on technology and the pandemic, because it did talk about this important need that we have in the sector about access of having communications with activities in the region. And from there on, we were able to see the vulnerability that you had, in particular, related to rights in our labor and human rights coverage, to social security in particular. How did was it hurt, and the pandemic, the effects of the pandemic and post-pandemic? What is the situation of the workers in and that we're seeing in all the countries in Latin America? So thank you so much. And thank you from Colatrao and from all our organization making it up. We'll continue having this support that has been given, that Kari has been providing to us. With that, I'd like to give the floor to Jessica Miranda Pinedo, the coordinator of the domestic area. And with nothing further, okay, my dear Jessica, welcome. Welcome, Jessie. She's too far away. Thank you, Elena. Good morning, everyone. And I am going to speak in Portuguese. And thank you for all the people that are in the forum. I'd like to greet all the present institutions in this opening address and throughout the event. And I want also to underscore the participation of the General Secretary of the Latin American Confederation of Domestic Workers, Ms. Pinto, and coordinating of the National Federation of Homemakers in Brazil. I'd like to greet Mr. Álvaro Velarca, represented by Vanessa, Executive Director of Research, that receives us today in CISS and carries out this forum together with Ana Main, the Director of Latin America and the Caribbean, Marcelina Bautista. Thank you for receiving us here in Mexico today and in the next week. And I also would like to thank my peers at Denise that work with human rights. We are an organization of the Global South. And 30 years ago, we started fighting for justice of women in our country and of our region. And today we see all the women in Cabo Verde, and because we are promoters to empower women. Why? Because, as mentioned by Marcelina, we know that the important challenge also related to homemakers in our country, in the region, is access and knowledge of rights. And we also know that we not only have the right we can reivindicate the right they have. So therefore, it's so important to talk about empowerment and also the exchange among organizations and the need to go deeper in the topic of social security for homemakers and in our countries and our regions. I would also like to talk about one point that I feel is important, that is part of the structure for access to Social Security and the lack of formalization of this category as a whole. And that has its origin of domestic work in our countries, in particular in Mexico and Brazil, that is the colonial origin, that is of slavery, of servitude that we had as homemakers, as home work. So we should talk about the technical barriers that limit Social Security. But I also would like to remind you that domestic work, remunerated work in Brazil, have a face. And so we can see it, and we'll hear, and we talk about a work by 92% of women, of men, women that are black, that are 68 of the that have an aging curve, 80% of them. So 10% of them participate, and women that are senior citizens. So the topic of the Social Security is urgent. So we know that a third that 35% have coverage. And as we know, in Brazil, we have an additional challenge that has to be with the topic that work per day, so that they are considered freelance and they don't have social security. They work in different homes every day with different employers every day. Therefore, how can we expand the coverage? How can we expand the legislation and change also in Brazil, we should think particularly about this topic of workers and also look for these incidents of social security that has been done by these organizations. But I would like to invite you and invite all the people here present to see the face of Clay and Marcelina, because they face how precarious our work is in our region, and they need to work in an age where they should be retired. And we also talk about a reality that a lot of domestic workers started working when they were 8 or 9 years old. This is a whole life of work without being recognized. And I know that society needs to recognize them. They don't recognize the value that's the fruit of their work. And with that, I hope the forum will bring us many more lessons learned. Thank you so much, Jessica. The reality lived by our peers in Brazil, in particular, the ones that work every day in different households that are freelancers. They don't have an agreement, as well as those workers that are not protected, and they don't have social security, and the system doesn't protect them, as well as the fight that they're having from FENATRAD and the affiliate organizations of the recognitions of what are our rights as household workers, that all women, all rights. So with nothing further, I'd like to introduce my dear peer, Clady Pinto, the Secretary of FENATRAD, but also our dear General Secretary of CONATRAO, the Latin American Confederation of Household Workers in Latin America. And we hope to see you very soon, Clady. And we'd like to give you the floor. Clady, welcome. My peer talked about work. And first of all, I would like to thank the space, and I also would like to greet each and every one of you, to the audiences that are present and remotely listening to us, and also greet on behalf of Luisa Batista, that is our coordinator of FENATRAD. Are you listening to us? The coordinator of FENATRAD, that she is a little far from us now because she's been sick. And I'd like to greet you, and I would like to thank you for this space. And also, it is also very important to talk about it, in particular in Brazil, because in paper, there's a lot on Social Security, and in domestic work, it is very difficult to ensure that what's in the law is put into effect, because most of the people do not honor this law. Therefore, it's so important for us and so difficult for us to try to validate with the union workers to be able to have this social security in Brazil. In Brazil, social security embraces three gaps. that are the part related to health, where the workers, where this registration have the rights of the Social Security work to receive inquiries, and they don't have this record. And we have the Social Security that requires this record to be able to have the right to the different resources, everything that the law includes. And the greatest problem we have is to uh, allow the ratification, because the law 89, because the 150 allowed some space or a bucket that separates the different vectors. And the 189 says that all people that work in a household are domestic workers. So we have this challenge, because for us in Brazil, as a head or as a person that's at the lead, in order to comply with the right of workers, the aristas are those people that go sporadically to homes to clean the homes, and those that go the whole week and have the total obligation to be working, and to have an obligation of certain days and hours, and they are not considered the arista. This is a person that has warranted rights, but the law 150 allowed this gap. And I'll talk about it at the time of the presentation, but I would like to thank you for this space. This is a very important space for Brazil and the region, for the Latin American region, and I talk on behalf of FENATRAD. And this space strengthens us. This space opens new horizons and allows us to improve our experience through the experience of other countries and states. So that's all I would like to say. Thank you so much. Thank you to the authorities. And I hope this is a great forum for all of us. Thank you. Thank you so much, dear Cleide, for your kind words. Really, for Conatrao, it's of great importance to have the effective application of the Agreement 189, that is an agreement of protection that is not on top of what is established by the law, but is a minimum protection to ensure and make the rights that we have, we can match up the rights that the homemakers have with an established schedule, with inclusion to Social Security, protection in the topic of health at work, an agreement in writing, a daily work. So, in this sense, we wanted to thank Leide and thank each of the panelists for their excellent presentations that we have had this morning. And I'd like to invite you to continue with us. We're going to close this first panel, but we'll continue with this forum. And there's other panelists that are going to continue. We want to thank each and every one of you for your participation face to face, and we'll continue with this forum. The people that are don't disconnect. We'll continue with the forum on household work and social security. Thank you so much. Good morning. We're back. We are going to talk about the household securities. I'm Vanessa Tolinowski. We're in the inauguration, and I'm going to moderate this table. So, this is the first panel, and it's called Route to the Evaluation of Social Security Modalities and Digital Tools. So, the panel wants to give some space for institutions, as I mentioned before, that is Social Security, will give us their experience in the implementation of incorporation programs to social securities of household workers and making emphasis in the limitations faced and in the good practices that could be spread in the Latin American region. For us, this panel is going to be developed with, we're going to have 4 rounds of participation, and each of them, people that participate that I'm going to introduce now, will respond to one of the questions in that we already sent you ahead of time, and I'm going to read these questions to you. The first 3 rounds are going to last 8 minutes for each of the participating institutes, and the last one is going to last 5 minutes. And we hope that in this last round, our peers will participate and respond to the last question, and they will present a conclusion about the challenges of the ways that could be faced. And I know, uh, so I'm going to be a tyrant and with the questions. So before we start with, if you allow me, I'm going to introduce people that are with us today, and I'm going to start with the people. So we am going to start with people that are here present. We have Eduardo Alcaraz. He studied economy by the Technological Autonomous Institute. He has a labor path of 20 years in the National Social Security Institute, focusing in the labor analysis and quotas, worker, employer, employees. He's been a coordinator of evaluation, and he is the head of incorporation to Social Security in the incorporation of tax collections from INS. He is co-author of the Challenge of Inclusion and Analysis of the Legal Framework of Social Security in Mexico, published in 2022 by Thomson Reuters, and has other publications as on the labor work and social security in international magazines like Lancet, National Bureau of Economic Research, Applied Economic Letters, and Perspectives. So, welcome for being here. I thank you for being with us. I have Adriana Petros. So Adriana Pedrosa, she studied economy by the Autonomous University, and she studied public policies by the by CIDE. So she is the head of the coordination of affiliations of the Social Security Institute where she's worked for the last 19 years. Within the same incorporation and tax collection, she's worked in different projects to generate and to start to end processes in a remote manner, and in the implementation of the pilot test for household workers and those household workers that are freelance. Adriana, thank you for being with us. And on the other side of the screen, we are very proud of having the presence of Eduardo da Silva. Eduardo da Silva is a public servant, has a specialization of government management and economy, 27 years of experience in the public. He has had different positions like the Ministry of Social Security, like the Ministry of Work and Employment, the Ministry of Social Security, and he was also a president. He was of the Republic. He also worked on social matters in the programs Wealth Familia in the Economic and Social Development Council. At present, he is a coordinator of studies and statistics in the Ministry of Social Security. He's participated in courses in the George Washington University, the University of Alcala, and the John F. Kennedy School of Government. Thank you for being with us. For us, it's an honor for you to be with us. And The last but not least, from Paraguay, we also have from the virtuality Americo Gustavo Riquelme Ortellar, and he's an economist by the School of Sciences in Asunción, and he has a master's in business for the Universidad Católica Asunción, has a master's and by the American Association Graduate Studies on University Education in the School of Asunción, and a specialty in the acquisition of by the Top Management School of Public Hiring. At present, he's the head of the Institute of Social Provision in Paraguay, and previously he has worked in Paraguay and the in information technology and communications, the Ministry of Education and Sciences, the, the electoral science, the national election of and public health and social security as well. He's been a teacher in the School of Engineering and the National Asunción University, published academic articles and chapters related to the labor informality, social security, and public administration. Welcome to Mexico. Thank you so much for being with us. And now I introduced all of our panelists from Paraguay, Mexico, and Brazil. So I would go to the first round of questions where each institution aims to my left, IPS, as well as MPS in Brazil, will have 8 minutes to respond to this question. The first question is I'm going to read it for you. And looking at the process through which the program was designed with the incorporation of household workers in their institutions, which were the number one adaptations that they had to do to have the different modalities where this work is performed per day, among other modalities. Thank you so much. And I'd like to give the floor to IMS. You have 8 minutes. Please go ahead. Thank you. Thank you so much. Hi, good day, everyone. And IMSS has, since 2019, has been working in the incorporation of household workers, and it emerged because of a mandate of the Supreme Court of Justice in the country regarding pointing out that it's unconstitutional for household workers not to be considered as the rest of the workers, formal workers in the country. Therefore, first we did a pilot test, and today we are modifying the laws, and now we have the implementation of household workers and what were the challenges that we had to face? They were many. First of all, we have to say that the main adaptations done were, first of all, simplifying some processes we had to do, and the employers and employees had to do or have to do. If it's a company from a different nature, not household work, they have to do three processes. They have to set themselves up as employers, describe the workers' risk. They have to see the auto determination of quotas for household workers. This is done in a simplified manner in one process and in a very simple manner using the information technology. This is how we did the process. If you have the information about the workers on identification of the employer, that in Mexico is CURP, is a national identity ID of the worker of the home. You also have this identity and the number of Social Security. The process for their incorporation and determination of fees is having approximately 10 minutes. It can also be done online. We automated and simplified, but that was not all. We also thought not only about the modalities of a permanent worker or a full time worker, FTE, or a worker that goes from Monday to Friday, but for all those people that work per day. And in that sense, the system allows all the bosses independently will comply with their obligations and could even point out the days where the person that's a household worker is going to go and work. And it doesn't matter how many employees are, they could have, it could be one person that has multiple employers because they work every day somewhere else. So they could point out each of the employers can mention how many days they work in their home. The system also allows for each of the employers to point out different wages because the application of all this information goes to a database where we're going to be recording what employer is setting up, what person with what wage, how many days. So, just to give the floor to Eduardo, I would start with this part of simplifying and automating and allowing each employer to declare the days that the person has at work, that they go to their home with their wages independently, and they comply with this obligation. Still, one more thing that the law foresees. Good day. And one of the improvements, managerial improvements, as well as an additional right that they have for household workers, is that today, with ease, that they can pay per day or per month if the person, the household worker, receives more than the monthly average is giving the full coverage is he gives us access and they can quote the 31 days or the full month. So this is an additional benefit that they have under this scheme. And not to take a lot of your time, I would like to mention what Adriana said, a very important part. The household employer, when they register the employee, they don't need to know anything about estimations and fees. They have to say the days they work, and with that, in an automated manner, they pay and they're registered, and that's all that is needed. Okay, thank you so much. And summarizing, thank you so much, Eduardo and Adriana. And I'd like to give the floor now to Eduardo Garcia Pereira, that he's also a member of the American Actuarial and Financings of CISS. Eduardo, please go ahead and thank you so much.
Queria agradecer o convite para participar deste evento e já entrando no tema da pergunta, eu gostaria de esclarecer primeiro que vocês estão me ouvindo?
I would like to know, can you hear me? Yes, can you hear me? Very well.
Estão me ouvindo?
Sí, se escucha, Eduardo.
Sim.
Can you hear me?
Queria dizer primeiro, a legislação
Well,
brasileira
I wanted to tell you that Brazil's situation in the domestic work started in 1902 and started expanding, and it treats a house worker, the expansion of this worker, the protection of the house worker in Brazil. It was in the sense of working with other normal workers that are traditional. I cannot hear you. I I cannot hear you. Can we try again? I'm sorry. Once again. Can you hear me now?
Vocês estão me ouvindo?
Can you hear me now?
Estou falando, vocês estão me ouvindo?
I'm speaking. Can you hear me now?
Sim, mas parece que não
Yes.
escutam lá no auditório, lá na CISS.
Yes, but apparently they cannot hear me in the CISS.
Posso continuar?
Can we continue? They cannot hear you. Can I continue then? Yes, go
Vou
ahead.
continuar. Então,
Thank you. So let me continue.
brasileira, ela
The Brazilian legislation, the expansion of the protection of domestic work was in the sense of making equal the domestic work with other workers.
nós temos duas formas no Brasil de trabalho,
And we have
né, que
two
trabalho
ways in
empregado,
Brazil.
o trabalhador
Basically,
que
it's
trabalha para
the
uma outra pessoa, que a gente
employee
chama aí
work,
quando ele tem um
the
contrato de trabalho.
employer that works for someone else, and that's when we have an agreement and they sign a registry of work. And
São os dois
we
tipos
have the
de
autonomous, that is the one that works on their own. There's the two normal figures that we use in the Social Security. And for home employees, home workers, we have two ways to be affiliated to the civil protection as a worker and as an autonomous worker. So, as an employer, employee, the contributions are done through the employer, and in the autonomous work, the contributions should be done by themselves to the Social Security by their own, as the logic of expansion of the social protection of domestic work was to make it equal for the domestic worker according to what it corresponds to the worker that corresponds to any type of company. The situations, particularly that are specific of domestic work, tried to be treated standardized with the workers. That means, for example, if an autonomous worker that pays on a monthly basis, that it has access to a civil worker, mechanic, something like that, can make the contribution on a monthly basis on individual way without uh, without being it important how many hours it worked. It's important the contribution. And when they have a work of a registered worker, the employer has to collect the contributions, and the employer is the responsible of registering the employee to make the payment and to inform the social security for the period worked and what it was collected. That was the employer's obligation. It is important that we can observe that in other countries there's a minimum value of collection for payment of social security that's over the minimum wage. And as many people have difficulties complying with the collection of the minimum wage, they could be doing it in a minimum value, and it allowed the domestic workers to get into those schemes of a reduced collection. So the home worker could pay an 11% of their minimum wage and to have all of the benefits. The normal quote is something that should be considered, and it is something considered to the fee that it constituted to create a micro company that is particular. And if they open, and it includes a percentage of the minimum wage, and that is why they consider the participation in the social security in terms of operation. As the logic was to make it equal to the housework, the same as other works. They didn't need any other changes to manage this. So the most important thing in the case of so that there's no loss of rights is that there is a record of the remunerations and the fees that were collected from the employer and everything that the employer gave. And in the case of the autonomous, he has to pay on a monthly basis, on a regular basis, and register this in the system. The employer makes a record of contributions and to recognize the right and to be able to calculate all of the fees that should be paid. Thank you so much. Thank you, Eduardo. We are very well on time. So now let me give the floor to Américo Riquelme in Paraguay so that he can answer the question. He has 8 minutes.
Muy buenos días para todos. Un saludo desde
Good
Paraguay.
morning, everyone. I'm glad that I can be sharing with you this time from Paraguay. Probably the most important thing that we should start saying here is that since 2015, the 507 law allowed that the sector and the regime of the payment of domestic work or home work goes from having a coverage according to maternity and health to also having coverage in what is risk labor and the possibility of having a pension. And it is important in Paraguay that is something that we can remember, and to make this type of work, domestic work, to go to something that is called general regime. And this allowed that these people could obtain the same remuneration, the same as any other employee, and that's what we call as general regime. There's where we have a great challenge, and that institutionally, Paraguay has a system, informatic system, where we can make the entire process of all of the wages, the creation and elimination. And through this process, it was very interesting because we had to make all of the adjustments from the new wages. And this was together to, let's say, a new regime of rights. And from those new rights, then new levels of what they had to give according to their coverage, right? So that is something that we were able to do it on not a long time. We made the necessary adjustments, and today this regime, the same as for everyone, well, it started from the medical service regime is the same as the rest of standard regimes. It's not a special, let's say, regime. So the people that are owners of like an employer that has a home worker, should pay or can pay the days worked, the hours worked from an app, in an app that it is downloaded on your cell phone that we call it Rate Pocket, where the person, the employer, only has to play place the days worked, and it is standardized to the minimum wage, and he makes the payment. If they have a higher wage, then the system makes the automatic adjustment, only adding the days worked. An aspect that is also important in Paraguay, and it is in the same line of what the rest of my peers said, is that it is the fact that since 2019, we could include the partial work. And this made a great challenge in the technical system, right? To be able to load the people, to consider the hours, and this has been being adjusted in the system, right? It's a web page, the Red system, and also the Red Pocket, that it's an app that we use from your smartphone so that we can make it easier the process of incorporation payments and elimination of any of the wages that are within the regime. So allowing that the people with a partial payment to be able to be paid on, let's say, half time, like a half time payment. That's why on the same line, this is what we have been having, similar to my colleagues that were talking about their experiences. The most important thing about this part for me is to remember that in Paraguay, since 2015, has been offering this sector the different levels of coverage of social security that they're offering to most of the workers from the Republic of Paraguay. Thank you. Thank you so much, Americo. With this, we finish our first round. Then we are going to start the second round. In the second round, we want to answer or ask our colleagues, participants, to answer to the next question. How have you incorporated the digital technologies to achieve greater levels of incorporation of Social Security to the workers, home workers in this case? I'm going to give the floor now to Eduardo da Silva Pereira first. Thank you, and please go ahead.
Gracias. El
Thank you.
Instituto Nacional de Seguridade Social do Brasil tem ao longo dos anos implementado cada vez
The
mais
Institute of the Social Security throughout the years has implemented more digital technologies for the optimization of the attention, analysis, and process of benefit of social security. And this is related to two dimensions. First, to make it easier the attention of to the workers, and second, to allow the institution to continue operating aside from a continuous reduction on the coverage of servers. So the investment in automation were not directed to specific publics, but to all of the employees and employers. Nevertheless, it's important to identify some dimensions where we use the technology and where it is specifically directed to the domestic employer. With the 2015 legislation that made it equal the rights of the employer and the domestic employer and made the rights of the employee the same as the rest, domestic employee, assumes a lot of responsibilities as the rest, payment of social security and other type of payments to make it easy and reduce some impacts, adverse impacts, mainly to avoid the responsibility to the domestic employer. It included a record system, official record system, called like that, social network included. And in this way, the employer makes the system of an employee, makes a monthly launching of all of the payments and what it has been paid. And the system generates a banking a unique document for all of the obligations that the employee should pay. Because in Brazil, we have to have a contribution on say, social security, we have a contribution of a financing fund, of unemployment that is called the a fund of a payment of guarantee without employment, that we have other contributions that the employer can also make. All of those payments are unified through the system that is called social network, and the employer pays one banking document with all of those contributions, and the system records that information, sends it to the government, and the information is shared with several public governments that operate those programs. So the fund of guarantee of time of service goes to the economic federal payment, and the data for the insurance of unemployment go to the Ministry of Work, and the data of the insurance contribution go to the Institute of Social Security. All of this is made automatized. So this system specifically is directed for the domestic employer. In the case of the worker, autonomous worker, the one that is their own employer that has to make the contributions individually. It's possibly that he makes his own recording or affiliation to the Institute of Social Security through a site or through an app in the cell phone. And also, they can have payment measures through the app or through the website. Throughout the dissemination of information part, they were created resources and training for the individual contributors, the autonomous workers that are the ones that work on their own. And this training were created through in a program that was created in Social Security Education, and it's available in the NSS webpage. And it is what you can see in the social webpage. And digitalization was firstly directed to the expansion of automation of the attention more than an instrument specific for the social security. That was with the expansion and automation, and it reflects a perspective that digital technologies are not necessary or cannot help in the inclusion of the workers in the system, in the social security system. But that was it, just because the resources were prioritized before the needs of the reality that we have, the amount of requirements and benefits that we have every month, and every attention was directed to that situation of automation of the attention and the benefits of the creation of the benefits of the social security. That is it, and thank you so much. Thank you so much, my dear Eduardo. Now I would like to give the floor to my colleague Benis to answer this question. I will divide this of the technological use or use of IT into parts. TI. One is that what the users do not see, that is this part of the systematization and automation of the records for payment. In Mexico, well, the payment for the people, home workers, have 5 branches of Social Security. That means that the number has to have segments. What type of payments are done for every type of of insurance, right? That it is done specifically to the respective Afore. That is automated, and from January 2024, everything is considered for the pension fund, and everything is automatized. So what we do see the workers, the domestic workers have is that the process can be done 100% online with 5 steps that are very simple. There is one microsite that it is created specifically within the Mexican Institute for Social Security, that is specific for this sector. And within this microsite, there is a sub package thought for employees, sorry, and another one for domestic workers. It has frequently asked questions, calculator, videos, different things, a lot of information, that everything is within the same place. There's also public publications in social media posts, and there's also the quote the quote the quote creation. That is something that you have to add. There's alerts on the cell phone of what has been paid, what is the wage that was recorded, and everything that has to be paid on a certain date. And if you have 1 or 2 people that are employers, then the both people appear with the name of who paid, so that the home worker can know perfectly who registered it and what is his or her wage. That's what we did, so that they are aware of that. There's also a WhatsApp channel that has been created where they give information. We know that a lot of the social media is not used by most of the people, but WhatsApp people do have. So there's a channel dedicated for the direction of reincorporation and creation dedicated for the home workers and that give this type of information. And I think that is it. Yes. Well, thank you so much. And if you allow me to say something to be able to complement for the people that are listening to us and do not know what are those 5 insurances that are mandatory for the employer to work for the employee, domestic employee, it's maternity, disease, a risk of work, daycare, um, old, old age, and retirement. And well, that is a mandatory in Mexico. That is very important to know. Well, thank you so much. So now let me give the floor to answer the same question to Americo Riquelme from Paraguay. Thank you. Once again, good afternoon. According to the innovation of technology for Paraguay, Paraguay has been working and aiming according to improving the connectivity with interconnection with the customers, with the owners of the accounts. That's why it has been promoted a certain campaign that are very strong from the different social media with the informational information where we post all of the advances that we're having for all of the employers, the system um, of payment, of recording, or adding the cell phone. The webpage of the institution allows the employers to access basically a lot of information for domestic work and for people that are there as the employers. So the webpage allows to see from there what are the different levels of coverage, what are the due dates of payment, what the coverage should be for a person, who is the beneficiary within the protection of the let's say owner of the worker. And if you want to know what are the years of support, what are the payments that are possible when we look for example for retirement, there are simulators that are on the hand of the people so that they can have access easy. And for us it has been a very good way to interact because of the availability of technological tools, for example social media that has been um, available for the people that are far away from our attention sites. And the technology has allowed us also to take through the IPS. There it is included a WhatsApp web where with time, in real time, a person can make a query and receive information, make clarifications. And this is open for employers, employees, retired people, beneficiaries of the of the employer, right? And it is a good benefit according to what it makes to the insured people and to their employers through the platform. They have a system where they can be protected and mm, and they can make any type of claim if they need to recover all of the information that we need to be able to make that process that is continuous improvement within any company. We have a portal of transparency of information, transparency of public data that has given a lot to be able to improve in many of the aspects that we have to continue improving, obviously. Very well, very interesting. Thank you so much. Americo. And now we have finished second round. Let's start then the third round. 8 minutes for every institution. And the questions to answer are the following. What are the tools of fiscalization you have employed to ensure the house workers for social security, specifically for Brazil? What are the lessons learned with the implementation of the social security, and what are the strengths of this initiative and the limitations? And as we said to Brazil, but also to Mexico and Paraguay can answer in that type of application. So let's give now the floor to Eduardo da Silva. Please go ahead. Thank you.
As ferramentas de monitoramento que nós
The
utilizamos
tools,
para fazer o acompanhamento, né,
monitoring tools to be able to give a follow-up to the access to the workers to the social security have two origins. We use on one side
né, os acompanhamentos dos nossos
administrative records,
administrativos e
the
também
follow-up
os
of our administrative record, and we have to use also investigation.
eu só sei os trabalhadores
Oh,
que são
house
filiados,
investigation, for example. In that record, I know what are the employees that have a contribution, but we also have a contingent of more or less 75% of the domestic workers that do not have this record and I do not have the information or record about these people. So it is needed to use this type of census so that I can have a photograph or an idea of the people that are working and that are workers, domestic workers. But do not have this type of contributions. In Brazil, we have a national census that is done quarterly, every year, and it exists a specific module with specific information that is more detailed, and we use this type of model information specific to give a follow-up to the amount of workers, domestic workers, that there is, and to be able to know that if they are registered and if we have enough information, if they work every day or any other type of information. Aside from the follow-up of this census, to be able to have the photograph of the universe of domestic workers.
And also some features of the work. For example, this annual information is based on the census and is complemented with information being produced by the administrative records based on this administrative record or registration. And this is information of those people that pay taxes or their contributions. And then you have a snapshot of the number of workers at work. So, what do they contribute? The administrative records, and we carry out an annual gathering. We published a specific chapter of the contributors. And in this type of contributors, we have information about household workers. And that's a way we can monitor the inclusion of household workers. And now, on the Social Security, this is a system that allows domestic employers to publish and also provide information to the government and have the estimation in the application of the employer. And some criticisms that we've received are specifically about the interface of the system that is not that friendly, the public, because domestic employers are not a company. Therefore, they do not have a human resource area to help them navigate in the system. So many times the complaint is the interface that is difficult. There's complaints about difficulties to carry out operations in the system. Nevertheless, the system wants to have a group of programs that are different. There's norms that are complicated, including all of these standards and regulations into the system is difficult. So sometimes you can best comply But it's not as easy. It gets complicated because of the complexity of the system, because of the complexity of the rules and the programs that are being consolidated and integrated in the system. And still, even if there's a specific module for domestic employers, this is a criticism that we've received about our workers. So nowadays, it's important regarding the progress, and it's also important to mention the fact of being able to share this database with different programs, social security programs. So when workers of this information goes to different bodies or programs in a separated manner, but everything is based in the same information. And this is important because we have this data that's homogeneous data and eases things up. And at the end, operations can be shared. And we have a case in Brazil that is the unemployment insurance. It's a program that is being led by the Ministry of Work in order to finance and has financing and is partially executed by the National Social Security Institute, that is a body of the Ministry of Social Security. So we have a shared database, and that's very important that we should underscore within the structure and the operation of the Brazilian government. And that would be all. And now, next, I'd like to give the floor to the colleague from IMSS, Diana. Yes, thank you so much. And with regards to the question, how have you used the taxing or the tax related tools? We have simplified, we've automated, we've used intensively information technologies, but still, what's important is that even if we do the simplification of these complicated rules, and that today the workers, household workers, have the same protection that the rest of the workers, and there's no special scheme. We do have some specific measures for them that look for the protection stated in the Social Security Institute, but that has not, it is necessary, but not enough for all employers, because we employers have a long path to go for employers to fulfill, to enroll and pay Social Security quotas or fees in for the workers, the employer, and the government. There are three-party contributions. These contributions, the employer's contribution, the employee's contribution is very small, but it depends on their wages. And in this sense, on the one hand, we have an automated system, a simplified system of many rules and regulations, and we have done a full campaign in the mass media, but we are still far. And another tool that we're not certain that will be fruitful is the topics of uh, charging taxes for workers as of the households as the rest of people. This has a mechanism that's called the claim or denunciation. You are to reporting. This reporting is done in internet. It can be done by phone. It can be done by email. This reporting can be done in the one of the 133 offices we have in the country, and the work and the employer has to say, my boss is not incorporating me. My is not incorporating me. This, so it depends on the wages. The contribution depends on the wages. They have greater the greater contributions, and therefore there is they say they pay less, so they don't have to pay so many contributions, but workers have to have a kind of French benefit or a payment because they cannot go to work because they're sick or because they suffered a work risk. So if they have not declare the wages, it's difficult. So there's where a lot of household workers find out that it's not the wage that they had registered. And then we have a tool, a personalized reporting tool that allows them to inform by mobile phone. And this is a great kind of surveillance tool. These claims can also, the rest of the workers have this has been useful for the workers because they know what is the wage they are being registered, and they give a constant monitoring to the how much how much are they getting paid, or how much are they being paid in social security benefits. So taking note of all the international experiences, I also would like to tell you about the knowledge and spreading of this information, because there's one thing that we still have to know about household workers need to know their rights, because they can report, yes, but in the case they had an accident, a working accident, or they had an accident on their way to work that is covered by the work risk insurance, or that their family had some problems, and for example they have maternity, so if they have to go to the doctor, what you can do, if they go to the health services and they say, I had this work, I had this risk, but I'm a worker. And if they're not registered, is constituted in Mexico what is called a constitutive capital, is a fine that is a large fine, a lot of money, because they are going to sanction the boss, because they have to give attention to these people, because they have to pay what comes out of it. If there is a topic, even in disability, they collect the they have to pay in the future. So this mechanism is a sanction that is a severe sanction because of non-compliance, because workers are requiring this medical pension. So these mechanisms we have, these are mechanisms that we use for the surveillance and everything, as you also mentioned very well, everything that has to do the automation and all the information technologies, all the procedures are also perfectible. Uh, so we also have to look in a more simple way how to communicate in all the automation when it's not working, or looking for the automation of claims. Uh, uh, so, like in the Brazilian case, there is a survey where we know where people that they say what do they work on, and there's a map in each of these local governments, and uh, how many workers are in the household and how many people are in the different locations, and that is going to allow us also to cross the databases and start doing some focused actions. And with this, I would finish, and I hope I didn't run out of time. No, you were right on time. Thank you to everyone for respecting the time. I think we're doing very well. So we are going to have a Q&A session. And so thank you, Adriana. We'd like to give the floor to our peer, Americo Gustavo, regarding the dimension regarding surveillance. From August of last year, we cannot hear you very well. You can give us a few minutes for it, please. Here, we cannot hear in the floor in the room. Can you try again, please? I think we fixed it. I cannot hear you. Thank you. I think that your microphone. Now you can hear me. Yes, we can. I apologize. No, don't worry at all. With regards to surveillance of the control processes that we've been implementing as of August of last year, we have started with going with the process of migrating from an oversight that is more aimed at the visits and the local expenses to the closing possible deviations on these declarations, on the exchange rate of the information with others. So here in Paraguay, what we have a centralized government. When we talk about taxes and the Ministry of Work, when we talk about we talk about finishing in general, all of them have the same level of application for the public, for all the population, the same level of depth towards a crossing information is crossing information of the population as a whole, and that has helped us. And that has contributed greatly in being able to verify that they produced under declarations on the Ministry of Social Security regarding what some companies were declaring of having credited wages to their workers, and what allowed us also to find that in other places they were enrolled in a place, but they were not enrolled in the provisional. So this information, crossover of information, has allowed us, as of some intelligence work, to request information, and that promoted to reduce. We saw how the these type of situations were reduced, at least at least inclusion of people under declaration is an issue where we continue advancing to see how can we solve it, because Paraguay has a serious problem of under declaration. So this doesn't help a lot. Regarding information crossing with the tax authorities, we were able to find that most of the companies cataloged as great contributors didn't even have one person registered. So that what has helped Paraguay is being able to go through this process of formalizing agreements, cooperation agreements with different agents on the state, and exchanging databases, and be able to establish with the Ministry of Social Security very interesting mechanisms to ensure the ministry are uh, we build it through the declarations that are done, like this that I told you is a system that employers use, because once a person that's owner of a company sets up an employee or terminates an employee in any of the regimes, of course, on domestic matters. This will also impact the Ministry of Work and Social Security, because then we can cross over information and we can have both in both institutions the same information. So this is a we can close the control circuit. And for us, these are cases that are very important that will allow us to reduce the under declarations and reduce the workers' informality. And as of this information, we also spoke about doing processes and interventions, joint interventions with the Ministry of Labor in order to ensure the reputational matters of both institutions. It's important that both are presented when we do this oversight. We put at risk the reputation of institutions. So we want to reduce possible situations and misunderstandings. And this exchange information also allows us to do some taxations, and that will allow us to reduce the reputational risk of both institutions in in order to optimize these processes. And as I told you about the existence of a portal of reports or a reporting um, portal is also applied for this oversight because these people that are working and part of the of the household service of a home or this employer can send an email. This employee can send a report by having access through their phone to these claims portal that we have. They send a report, and in those cases, no question in this in like in some time we do the oversight. And these are experiences that are very good for us, and they have allowed us to reduce the labor informality. We have not reached the levels we want, but it has allowed us to improve these. And reputationally speaking, it has allowed us to maintain and keep better controls. Thank you so much. And we're going to share the information, and working together has been, I feel, the constant of the all this intervention. Let's go to the fourth round. This fourth round is going to be only 5 minutes. In this round, I ask you to help us answer this question and some closing words. The fourth round wants to answer the next question. What barriers can you identify in order to find better levels and what alternatives do you see these levels? And now, Eduardo da Silva, I would like to give the floor first. Thank you so much. In the case of Brazil, one of the main difficulties in order to expand the coverage of household workers has to do in the way this work is done. Because in Brazil, we have a society that gives great weight to interpersonal relationships, and we have a society that is slavist a little bit, and work that is done in a household usually generates intimacy between the employee and the employer. So the context is where it is more difficult and where we can understand this logic of rights. And as of these different characteristics. Therefore, this group of factors that I mentioned are explained because today we have all types of workers of a household. Only 55%, only 45% of them are registered. We only have registered 45%, and the legal system in Brazil allows workers to report employers even after 5 years after their labor relationship ended, and fines can be applied to the employer. And even with the existence of these features, we have a high level of informality in domestic work. Therefore, this context that I mentioned helps us explain a little the difficulty of progressing in this coverage. So, with this perspective, what's important is for equality in the legislation to happen, something that has happened in Brazil. You are trying to try. Um, so, um, so what we have is work. It's important to improve. Uh, so reducing costs. Uh, So they have a contribution, we have inclusion, we have a contribution. Uh, so we have a low coverage, and they have the tradition that it is necessary to promote a cultural change regarding domestic work so we can progress in the inclusion of workers. And this cultural change has a main goal of promoting work of workers and of domestic workers and valuing their work. And this cultural change is a difficult task and cannot be left alone in the hands of the state. The players in society can also contribute for this change and this change of perspective. So between the employer and employee, so this cultural change is important, and spreading the information on the inclusion, the rights that exist for employers and also for employees is also through mass tools and through media, for example, digital media, social networks, and other digital networks, and uh, other media like TikTok and WhatsApp, and so also the spreading the information. So it's also important to see campaigns that will allow us to make a reflection about the importance of social protection of employees that are in their homes and the risks that exist and on the formal work. So creating these campaigns with this content so that these cultural changes, and then to see if finally like a provocation to mention. So I think that this has to do with work home. For example, Brazil and Latin America as a whole are in a process, in an accelerated aging process of the population. A large number that are senior citizens, those that uh, the composition of society here is going to be an effect at work. So now we are going to have less workers, like people that look after, less people looking after children, more people looking after senior citizens. So there's going to be a change. And then other people are going to have to need one or two or sometimes even three workers are necessary for people in senior citizens area, and having three workers, so few families can have these. So the process, aging process of the population is going to bring an increase in the demand of work, and we have to look at the new ways of organizing these services for families. And then also, these are smaller families with less children, and this is a perspective of the future. And to some extent, is going to have an impact in inclusion and also the costs that they are going to have in inclusion of workers in Social Security. And that's all. Thank you so much. Thank you so much. We would also have to see this later on, but I don't want to take more time. I'd like to give the floor to Eduardo Alcaraz. Eduardo, please. Thank you. So, first of all, in order to have better results, we have to focus ourselves to change this focus on insisting in the spreading and publication of the information. That's very simple to enroll your home workers in Social Security. Just a couple of data, and in 5 minutes, social workers are going to be enrolled. So remove the myth that the government processes are have a lot of red tape and they're very bureaucratic. In this case, it does not happen. It's just a myth. And then the other one is the mass campaigns that have been done recently in Mexico. In Mexico, we did them at the end of last year. We had an impressive campaigns of spots in radio and TV. We had billboards throughout the country. And in order to try to follow spreading these obligations that people, employers have about household workers. So this is something that we have to continue spreading. So what are the campaigns and what are the strategies from now on So it's focusing, it's changing the culture. It's making sure that how household workers are not seen as part of the family. Yes, they're part of the family, but they have rights as workers. They have rights and obligations, and also focusing that's easier, cheaper, and non obligation of paying the Social Security fees. Just to give you, like with minimum wages, it's around 60, 70 pesos a day, including the Fonavit fee that if we have a contrast, if you have a problem or a sanction, if you have not recorded or registered this person, as Adriana said, these are the messages. And then the consequences, the legal consequences are very serious. So they're going to focus in social networks. They're going to do spreading information that are controlled from the central manner, some of them, and others from the offices, the representation offices in the country. So we're going to put banners in all the apps of IMSS. So you have the reminders that today from the IMSS app, digital app, any worker, any person insured does has an appointment for a medical doctor's office. As soon as they get into the platform, before they enroll in the clinic, they're going to have an information. If you have a worker, then you have to be, you're going to put in all the messages that we can. So now there's going to be another campaign of emails. And of course, with all the digital systems, the same, we have all the people in the country that have gone in on the virtual apps, we have their emails. So have a campaign to send them an email and also to public servants. And we're also working with Mexico City and different entities for the information on the real estate tax voucher has a kind of information that you should enroll your domestic workers. So for employers as well as for employees. And this is what we're doing right now. Thank you, Eduardo. I cultural change again. Eduardo, thank you so much. Now I'd like to give the floor to Americo Riquelme. Please, Americo. I think that in Paraguay, at least, the greatest vacuum we have or gap is building a culture. Please, volume. Can you increase your volume? I think that the volume is very low.
¿Sigo?
Shall I continue? Yes, yeah, now it's better. Thank you.
En Paraguay
In Paraguay,
probablemente
very
nosotros tenemos
likely,
respuesta
not
al
only
régimen de
with regards to
seguridad social
the social
de
security
este noble
regime for
colectivo,
this noble
sino para
collective,
todos
but
los
also
regimes.
for everyone, for all the different
El principal
regimes.
desafío
The greatest
sería
challenges are
generar una
to generate or build a
cultura de
culture
seguridad social.
on Social
Paraguay tiene una
Security.
pirámide
Paraguay
poblacional
has a populational pyramid
interesante.
that is quite interesting. It has a demographic bonus nowadays uh, to develop.
Este
And
colectivo
all of these
tiene que
group of
estimular
people of the demographic bonus and the group of people that are in this regime,
mantenerlo
we have to convince them, first of all,
y es social
that Social
un derecho,
Security is a right, is a core right, is a need that
no debe ser vista
should
como
not be
algo que
seen as
sucede
something that is
en el
going to
largo plazo,
happen on the long
sino
run,
algo que
but something
necesita
that is
ser previsto
needed to be
para que
foreseen
cuando
so that
necesiten
when you
cobertura
need
de
the
salud,
coverage, health
maternidad, cuando
coverage,
necesiten
maternity
llegar
coverage, when
a
you
esa
need to
situación que
reach to this
necesitamos estar protegidos
stage where we
y
have to
es
be
estable
protected, when you have to have a
en todas las
stable
situaciones que
uh,
puede llegar a
wage, you can
ocurrir.
achieve so.
Hay una
and now there's a culture, and so everybody has to think that we need the social security. Now we are going to for social security and for other retirement funds. So the first challenge or the first limitation that we can find in Paraguay is finding a culture. How you do so? You do it with education. We do it with awareness. We can do it with. We have a social provision system with the Ministry of Education. Some years back, I think it was in 2016, we were able to ensure that the program that we had in Social Security for All, that's a program developed by SIG and CS, was like a curricular mesh, and it's had its important quota in creating awareness, but we still have a gap. We still need to continue having to go to different stages to create this awareness. And other important challenges are the fact that we have very low coverage in Paraguay regarding the social security in this segment. Tax evasion is very important. Evasion is important, and it has to do with the awareness that employers and employees have about this important need, the infrastructure, and it doesn't allow us to have control processes, and it becomes kind of an important challenge. The fact that we can reduce informality in this segment. And I was telling you a few moments ago, this information crossover that we have is important, but we also had a joint oversight, but the oversight that we have between Social Security and the tax authorities is not enough. And with that, we're saying or we're thinking that there's other mechanisms that are different on looking to surpass these limitations of infrastructure, material infrastructure, personal infrastructure to develop the control that will allow us, that will give us informality. And then in Paraguay, the greatest challenge is building social security. And this is going to be achieved with education and also with rigorous control. With the different institutions that have to ensure the coverage for people, and so this is important. Thank you, Americo. The culture of Social Security. If you allow me to make a commercial, we're working on this topic in the conference, and here we have books and materials, and we'll talk about it. We are highly interested in this topic, and it's important to have a change of culture to ensure to lower informality. That is what many institutions are looking for. And we're done with the 4 rounds. And now we have, thanks to the fact that you did honor your time to have a few minutes for a Q&A session. Thank you so much. We have a few questions that were asked through the Zoom platform. But before we go to the Q&A session, I'd like the public here present, if you have any questions in particular that you'd like to ask our panelists.
No? Then go ahead. No, from the audience, please. Good afternoon. Please. Hi, good afternoon. Hi, good afternoon. Thank you so much for this first encounter and to the conference for gathering us on this route of a long journey. And thank you to all of the people that are driving this amazing path, and to the home workers, household workers that have been decades making the path through many, many resources. In residence with this challenge that we're mentioning, that it truly can materialize those necessary changes also means a cultural revolution, right, in the interior of the household, and that also those processes are on a long term, right? And a question that I have, mm, eh, in an association that we collaborate here in Mexico with the peers, making a lot of work and accompanying the workers to assume that responsibility and conscience is. My question is, what is the experiences that we can learn from other countries of the region in Latin America to be able to have an agenda, right? There's a lot of challenges. This is very expensive. And united to this education, to this sensibilization, it can be a path to generate that notion that the homes are also something that we could consider. That's also something to be aware of, to know what are the experiences and to know if that also allows us to what to have and to be able to know and be aware of what we have in Mexico. I don't know, Alejandro, America, someone wants to answer this question. And well, according to the inspections in Mexico, we have this part of the claim. And in the part of the inspections, well, um, I think the IMSS has to be incorporated with the Secretariat of Work because, as we mentioned, it's something that is a little bit complicated to make inspections in the households and to also have, well, the capability. We do not have the capability to be able to inspection. So we have to think about something massive and cultural to be able to allow it to go deeper and to incorporate all of the household workers also into this. Well, thank you so much. Anyone else wants to comment anything about the subject matter? Eduardo, Americo, maybe? No, not really. Well, thank you so much. And then I'm sorry to all of the people that are through the Zoom. We have a lot of questions. And if we allow you to participate directly, then I will not have enough time, right? That's why we have the chat. And the most important thing is that maybe we cannot answer all of the questions right now, right? Because we do not have enough time, but we will be sending all of those questions to our panelists, all of these questions that cannot be answered. With this clarification, let me go then to a question that I believe that is good for our three panelists. And it's a question that asks if a person who works 3 days a week has a right to social security and complete a medical service all the time. Who wants to answer? In the Mexican case. And in this case, in the Mexican case, the law of social security has a positive discrimination. That means that there's a law that this act allows a person, a household worker, to be covered with all of the services equivalent to a minimum wage without considering how many works a day they work. So if she works 3 days, by 4 it's going to be 3 days, but it depends if they get into the wage that in a month is a minimum wage of what you pay on a minimum contribution. That is how you can cover this person to be covered the entire month. That means from the first to the last day of the month. That is what we do in the case. In the case, the system does it automatically, but there are workers that have two employers And in this hypothetical example, if we have a household worker that goes with one family Monday and Tuesday and then goes uh, Thursday and Friday or Friday and Saturday, there's a day that she's not receiving um, money. But if you see the quote on the minimum wage, the payment of the contributions that are equivalent to a minimum wage, the contributions of a minimum wage, then she will have the coverage for the entire month. They add up what one contributes, the other contributes, and you can, well, with one employer or two employees, you can get to the amount and not necessarily be working from Monday to Saturday or Monday to Friday. That is what they thought today. And on the system that we have, it's something that we should allow. Thank you, Adriana. From Eduardo Peña, I have a comment. In Brazil. In Brazil, a person that works 3 times a day a week, if it can be for the same person, it should be recorded as an employee. And if it's for one of the employers, maybe let's say 3 employers, then they're gonna be recorded as autonomous employee, dependent employee, and she would have to make their own contributions to the Social Security. So in that case, she can be considered as she works not a lot of days and she has a lower income, then the base for the contribution for Social Security is in the minimum wage. Maybe working 3 days a week, she gets to that minimum wage. But then she can have a minimum wage, but with that fee reduced, with those plans of inclusion that I mentioned, with the fees that are lower. But if it's autonomous, then it's going to be responsible of its payment and the contributions related to health. In the case of Brazil, we have a universal system that is not linked to contributions. So all of the citizens have a right. Thank you so much for answering in Paraguay. Also, well, maybe Americo is having connection problems. So if you want, we can go to the next question. There are many questions. We are not going to be able to cover them all. I'm so sorry. But they're in the chat and we're going to send them to our panelists. Please try to understand this. For Eduardo specifically, what is the criteria that you use to define that on a daily person works autonomous? And is it autonomous and sporadic use the same? What is the percentage of household workers that are classified as autonomous workers? And what is the percentage of the people that are considered household workers that are autonomous, that are enrolled in the Social Security? I know that it is a lot of questions, but please. In Brazil, if a job or a worker works more than 2 days in one same place, in one same house, with the same family, then it is considered an employee 2 to 3 days a week. If we work, for example, 2 days per week, then we can be designated as autonomous. If it's more than 2 days, it's one employee. Sporadic autonomous, well, sporadic, the autonomous worker is that the one that defines its own work. So if they work 1, 2, 3 days, etc. Well, this in Brazil is going to be the same situation between an autonomous and a sporadic one. So what is the percentage of workers that are classified as autonomous? Well, the truth is that we have around, according to the data of 2022, 5,800,000 household workers. And from those 3,300,000 are monthly. That means that they work in a monthly agreement, and the daily workers or independent workers are 2,500,000. So it is more or less 5% of the workers that are considered as daily workers. And the other question was what? The autonomous worker. Well, on principle, all of the daily workers are autonomous, so they would get into that category. It would be 50% of all of the domestic workers. That would be potentially autonomous workers. Obviously, it is only a small percentage of the daily workers that have Social Security. So of those 2,500,000 daily workers, 600,000 are the ones that give contribution for their own Social Security. So it is 25% of these daily workers that make their own contributions to the Social Security. I think those are all of the questions, right? I think yes. I don't know if there's anything someone online is asking if Americo from Paraguay can answer the same questions that we made to Americo from Brazil. Do you want me to repeat them? Is Americo offline? What happened? Oh, she has connection problems. Well, we will wait him to connect back and we will make the next question, the same questions. So from the IMSS people, we have several questions. One is how IMSS gathers all of the contributions from the household workers. Well, when they make the incorporation to the Social Security, as we said, we have 5 insurances here. Medical attention from the Medical Mexican Social Security Institute is registered, right? And there's the employer that pays the contributions. So in this format of payment, there's a division between the fees and what the Social Security Institute manages in disabilities and life, daycare, maternity, and all of those. And this same is paid in the same format. It is paid also the retirement or old age insurance. So all of this is done through the banks on an automatized way. That retirement money of advanced age goes to the pension fund, the individual account for savings for retirement. That money that goes to be able to save for the retirement doesn't go in for the administration of the Social Security Institute, but it goes through Institute services and it goes to the account of the worker. That means that he is having his savings, and in the same part, it is paid. Another situation in Mexico that it is the savings for household, that it is Infonavit. That percentage, 5%, that is according to the wage for the employee for the employer, it's what is paid to the Institute for Household. And this institute is going to give a credit on the long term for a person to buy a house. So that is the insurance, right? That is paid when the employer registers the person and it has the obligations, right? And the IMSS has to make the estimate, and when the estimate is done, then the distributions are given, and that's how it is paid. Thank you so much, Adriana. And to be able to close this round of questions and answers, a question that seems simple, but needs attention. The people that are employed, working, and in the household, or if they only work taking care of children or taking care of senior citizens, how are they considered? I know it seems easy, but who wants to answer? Definitely, these examples that you're mentioning are considered and are people, household workers that should be registered. Definitely, there is a part that has visualized when this pilot program started is that there's men, different chauffeurs or people that work in the household with the plants, for example, that do not are not considered household workers and they should be registered as so. Eduardo from Brazil, is there any comment?
No Brasil,
In Brazil, it is considered a household worker any person that works for any other person in their household. And that person, that is the employer, shouldn't be earning anything, right? That all of the activities that are performed are considered domestic work. They are included. For example, in a pilot of an airplane, if the family has an airplane and the pilot works for that family, then it's a household worker because it works for the family and there's no end of lucrative ends for that person. That means that they work, and not necessarily the work should be performed at the household. For example, in a case of a person that they take their clothes, they wash it, and they do it in their own house, they also can be considered as a household worker. It's not a fixed employee because it's not the activity that they do on a daily basis, but it's something that it is linked to an autonomous worker because they work even for more families. Well, thank you so much. We are over 5 minutes of what we were programmed, even though that we started late. We thank you so much for your participation, and we are here for you for any of your questions, and thank you so much for all of this information. Please don't disconnect people that are online because we will have another table that starts in 5 minutes. And thank you so much, Eduardo. Thank you so much, Americo. Thank you so much, the other Eduardo. Thank you, Adriana. Thank you, everyone, for your participation. Thank you, Adriana. And thank you, everyone, and the team of the CISS that has been able to achieve this. Thank you so much. We will continue.
We're back here in our forum. We're going to start panel number 2, and there's a voice enough. I'm going to give the floor to Maria Mercedes Martinez. That's going to be the moderator of the second panel. And the second panel, this affiliation to Social Security of household workers, progress and challenges. And Maria Mercedes, we'd like to give you the floor that she's with us virtually. Maria Mercedes, hi, thank you so much. Thank you. And there's no video. Ah, there it is. Good afternoon to all the audience. And we're going to start with the second panel. And I'm sorry, we cannot hear you. Can you hear me? Yes, we can hear you. Can you hear me? Can you hear me? Virtually, we can hear you, but in the room, they're having problems and we cannot hear you. You can start again. I think we can hear you. We solved the problem. Please go ahead. I only wanted to check that everybody can hear me. Yes, we can. Good afternoon, peers, guests to the second panel. In the exchange, the forum regarding Social Security and household workers, the second panel, where we're going to talk about affiliation of Social Security of people that are household workers, what is the progress and what are the challenges? And we want to give a space so that labor organizations can give us a diagnosis of all the progress recorded in the incorporation of the workers that have been household remunerated into Social Security, as well as the challenges and barriers being faced in order to achieve greater levels of coverage. This panel is going to have around this panel is going to have 4 questions. And to start, we're going to introduce our guests of honor. Uh, we have Elena Perez. She's the secretary, Dutch secretary. Is going to address the floor and welcome us. Claire Pinto. She's the general secretary of the FENATRAD from Brazil and general secretary of CACEH-Nacional. Panelists, Marcelina Bautista, the founder of CACEH Mexico, and we have Brasilia Maciel, General Secretary of the Syndicate Workers of Household Workers in Paraguay. And we start and we'd like to welcome Elena. Elena, please, can you welcome us to this panel so we can start with the rounds? Elena? Elena Perez, can you hear us? Well, so we are going to wait for Elena to connect again. If not, let's go to the round of questions. Okay, I want to thank my dear panelists and special guests to this second panel, where we are going to listen to the experiences of each one of the General Secretariats of Brazil, Mexico, and Paraguay. So that we are going to start with the first question, the first round that has 5 minutes. For each of the questions, and the answer is 5 minutes. We're going to start with the Marcelina Bautista, founder of CACE. And the question is, this question is for everyone. This is the first question. What is the progress in the incorporation to Social Security of household workers in your country? Who starts? Welcome, Marcelina. We'd like to give you the floor. Thank you so much. And I would like to start a little by talking about the previous table. And I believe that for us, this is an important challenge to hear the states in different countries that worries us a lot for the progress of household workers in Latin America, and in particular, Social Security. And for me, this would be the number one challenge for the state to assume the incorporation of Social Security for workers, household workers, but not only Social Security, the labor rights of workers, household workers, that if they do not have, they're not going to have Social Security. Even, so I feel that I would like to start with the challenges, but also what worries us. You have 5 minutes. I'm sorry. They're telling me the time I am allowed to speak. And for us, it is of core importance. In Mexico, we have important progress as of 2019 that they've reformed our laws so that all workers, household workers, will have the same rights that any person has, any worker has. Also, in 2018, we ratified the agreement 189. We also have the ratification of the 190 agreement and the past November. We made mandatory the incorporation of Social Security for household workers, and for us, these are important progresses. But we have a lot of challenges where it is not enough because all of the mechanisms that are being created from the Mexican Social Security Institute, as well as the mechanisms that create our instances for this progress, we also see that there is a very low number of household workers being incorporated. And talking about Mexico, and I'm not only talking where we can see Brazil, Paraguay, and we don't see a large number of household workers incorporation. So this is a different challenge being presented by our organizations. And how much or how possible is our alliance with the institutions in order to progress this rights of household workers? And on February 6th of 2024, there were 64,639 household workers enrolled in the Social Security. And in the previous table, they spoke about a pilot plan that starts in 2019, where we have another test to remove barriers and to allow people, employers, without any problem to ensure their workers. Nevertheless, by not being mandatory, then few workers had access or were incorporated. Therefore, we're talking about the fact that in Mexico there is 2.4 million household workers, of which the 64,000 the number is not enough, but every day we are having more household workers affiliated. Every day they're being affiliated. It doesn't mean that this is a progress. This is huge progress, but it goes step by step. The fact that we have had not a lot of time that is mandatory. We haven't had a lot of time for employers to notice that they have to pay, that they have to register their workers in a mandatory manner. So there's a different challenge where we have to have, and let me tell you about our proposal about the cultural change that we are setting forth from our organization as a basis in order to drive the reivindication of right of household workers from their homes. So yes, we are saying that only 2%, 2.6% of workers, household workers, are incorporated in the Social Security Institute. So, out of which They obtain Social Security, but they do not have a working contract agreement. So, what we're saying is that for us, it is an important challenge to change the culture in the households so that we understand it as a workspace. So, we understand it that these are patterns where they hire someone and they pay them and they are employers and they have to do the coverage of all the household workers' uh, rights. And I also heard the panelist in Brazil that said it's necessary to have a cultural change. Yes, I think that they said that the cultural change is education. Of course, cultural change is an education at an overall level, but if we don't start with this cultural change in households, we're not going to be able to ensure we won't achieve this change needed for a household worker when it starts working in a home. They have rights, that all their rights are fulfilled, and they feel the person, the employer, feels an employer, and they are an agent, a responsible agent of household workers. So what we said was that the culture and the labor paradigm, the household world has to transform the way this work happens in homes. For us, this is a group of beliefs, values, and assumptions that influence the way we perceive, understand, and address a certain activity or area in the life of household or at a general level. The concept of work, of household work, our main focus and our main attitude towards the tasks done at the household. For example, the work, the household work in societies, acknowledging that the work is core for the well being of families and society as a whole. However, historically, it's been undervalued, it's been considered as exclusive responsibility of women. For us, it's important to talk about the labor paradigm, the work paradigm in the home, because this benefits the whole. This benefits all the group of people that live in these places, and for them, we have to see it from this idea of change and equality of gender, sharing, for example, sharing the responsibilities of the household, promoting an equitable distribution of the tasks and helping and help of these roles that happen. And sometimes we're thinking that this task is done only by women, and therefore men shouldn't contribute or don't need to contribute to this work. So we have to talk about equality of work. And also we have to also, the sound was bad. So we also have to say, through this cultural change, that there should be healthier relationship because we assume the work in the home, and this work is not only the responsibility of women and men, and also of minors. And the minors are the ones that are also our small employers that start mistreating household workers in their homes. And it is very important from the work to talk about the development of all the things household workers could learn and develop skills related to household works, and this promotes autonomy and personal growth. And I feel that we also have to talk about the fact that from households we have to educate so that boys and girls are independent in their home, in their lives. And also, we spoke from the working paradigm. So what we worked in our paradigm, the sound is not very good, and she's cutting off. Now it's better. So the advice to implement this change are fostering communication, open and honest communication among the members of the household, establishing its expectations and responsibilities for each of the members in the households that are clear, dividing the tasks in an equitable manner according to the preferences and skills of each person, acknowledging and valuing the work done by each of the members of the families, being flexible and adapting to the needs and circumstances of these changes. And as of the fact that in 2023, when our fight starts, we did not know our rights. We did not, the state did not acknowledge us as household workers. Laws were not in our favor, they were not clear to benefit our rights. But as years went by, the incidents done allowed us to change this structure and allowed us to join different movements and different instances like CISS and like all the other or bodies that helped us change the laws in favor of household workers in Mexico. So we therefore consider that if we were able to change this structure from the laws, we are able to think that the cultural change should happen from the households. Also, they told us a second ago about the concept of how do you define the law in Mexico? How do we define the household workers? This is very important because we have found this story about the respective names towards household workers, where in 1988 they started modifying this language that have affected the self-esteem of household workers, and not only in Mexico, but we're talking about more than 16 countries that are affiliate to Colatrao that have received respective names, and that also has not helped to the fight in favor of the fight of household workers. Our laws in Mexico define define people, household workers, that are those that in a remunerated manner carry out care activities that support cleaning and any other activity related to the household under a framework of a relationship. I'm sorry. If you could put mute your microphone in mute if you're not asking a question, it would help us very much. So under the framework, the definition is household workers, and the hiring of a household worker has to happen under the framework of a working relationship. And what does it mean? It means that household workers have the right of signing agreements at the time they are hired, and still this doesn't happen really. And there I'd like to give you a different challenge in order to organize a challenge where the household workers would not be afraid anymore to demand their rights. At this point, we're working about workers, and not only workers in Mexico, but we're talking about other countries. Workers, household workers prefer to keep quiet because they're afraid to be fired, because that's the only job source that they have. So there is going to be no way that a worker will demand her rights, would value her rights, and would lose or would be fired. This is a challenge for us. And to talk about the rights of women and empowering them, and also all the campaigns that have to do with the empowerment or have to do with helping towards the empowerment of household workers. So they demand these rights that are established in our laws. And for our peers from Mexico, that and the question said, household workers, we work 1 day, 2 days. Do we have rights? Of course you do. The law, the Social Security law, and that's why we had a pilot plan where many changes were done. And now the law, the mandatory law is that as of 1 day of work, people have right to be insured. And if you have 3 days, as Adriana said a second ago, if they have 3 days of work and they cover the wages established by IMSS for their coverage, in the month, then we're going to have a social security throughout the month. And this modality that happens in social security is precisely because in the pilot plan, household workers were in charge of telling each employer to enroll them in the Social Security. And employers, some wanted, others didn't want to. And many times workers have up to seven employers. So it is not or was the job of the household workers to ask from their employers to enroll them. So when the Social Security law was reformed, him said, as of 1 day, all employers, each of them should register their workers. So workers to start that work 1 day or 2 days or 3 days or 4 days or 5 days or 6 days or 7 days have the right of Social Security. Don't ask more if they do or not have the right. We said the laws in our countries have changed. We do have the proper tools to support these rights and support these rights. Therefore, you are allowed to have these changes, and it's important for you to be prepared, to be trained, and training is of utmost importance. Your training is very, very important. And on behalf of all the workers that we represent, and in the name of all the organizations in Latin America, it's very difficult for us to to bring people to the workshop. Sundays is the day that we work. Sundays here and in China, we gather on Sundays because that's a non-working day. So our days of work are from Monday to Friday or Saturday. So we understand that household workers are tired, are so tired, but there's no other way to than demanding our rights, to empower our rights, and they cannot put aside or put in the hands of the employers their rights because they are there not to give them rights. They are there to fire them when those rights are being demanded and asked for. So you have to prepare to make sure that these rights that we've earned have to be given. And very quickly, I'm going to talk about some tools that we have so that we can support in this exercise of rights of workers that here in Mexico, and we would like to share with you some of these tools. So we have a tool that was created with other organizations in order to gather recognize violations of human rights of household workers, and it's called Violentometer of Household Workers, and you can find it in the CACEH page. And we created this violent meter, and we did a study, and we found 17 ways of violence within households towards household workers. So as a result, these violence suffered by household workers, they don't know that they are being exercised or that they are being suffered. So look at these violent meter to pay attention on that so that employers look after having a healthy relationship of the workers they have with. And we also have a working tabulator that has been defined by our organizations as an exchange or because we had not defined some minimum professional wages for household workers until 2021, that the fee of minimum wages was established for household workers. And from there, this wage, this minimum professional wage, is the first category that you're going to carry out in order to collect the minimum wage and not under that minimum wage.
Making the activities, the general cleaning activities, the more light cleaning activities. Then you will find the other four categories that will increase the wages according to the activities that you perform. That's why if the employer tells you, um, I'm gonna pay you with a minimum wage, well, it is not like that. The enrollment to IMSS that you require has to be with a real wage, because if not, that's gonna affect the inspection of you going forward. And we believe that we have the agreement, working agreement, where we're establishing all of these ways of a working relationship where you establish hours, activities, wage, extra hours, and all of the agreements that you agree upon and you have written. This working agreement considers the how long have you been working. That means if you've been 20 years in this work and an employer um, tells you goodbye, your final payment are gonna add to those 20 years. So it is important to know this working agreement. And we also have the application of CONASC. That was an application that was mandatory for the COVID moments where workers, home workers, could use this tool and employ the technology to understand our rights. And this application makes a lot of noise so that the household workers and the employers can access to the IMSS and register or enroll the household workers. And this application offers information about social security and the 189 agreement, the working act, and the 190 agreement that is being used right now to make this difference that the workers use. And a good news for all of the household workers is that a working secretariat of Mexico City has had a has had a new act that they're gonna inspect the households where they can see the real time that the household workers work, and they are gonna avoid discrimination, avoid the exercise of all of the rights that this new act establishes, and the incorporation of if an employer is denied to enroll them to the social security, aside from what Adriana was mentioning, that the employer that does not cover to enroll them in the social security, then they can have sanctions that are very strong, or penalties. If, let's say, a household worker is fired or has an accident, or if she goes to the social security, then she can say that she has an employer that did not give her social security, so they can have that inspection And all of this information about the complaints that can be done, you can find them in the pages of the Ministry of Labor webpage, and you can find it for Mexico City. Thank you so much. Thank you so much, Marcelina, for all of your information. Thank you to all of the panelists that we also have here today in this last panel with the enrollment to Social Security issues. We are going to continue with Cleide Pinto for FENATRAD, Secretary of FENATRAD, and with the same questions. Let's continue with this. What is the advances in the enrollment to Social Security for household workers in your country? And what are the good practices of implementation institutionally for the household workers according to Social Security? And what are the challenges that we have found as an organization to find to find an acceleration of the enrollment of all of the household workers to the Social Security? Thank you so much. Thank you. I believe that I'm sure that the main idea is make the household workers to stop depending on being household workers. That means that that's fundamental because that makes it easier that they can accept the um, working registry, let's say. And what it is good for category 150, there are some defects and some lagoons because Brazil ratified 8 or 9, and that makes the separation of 150. That the 150 Act says that they only have rights with 3 days in the same household by week. That it was something good, 150. But at the same time, we have the difficulties that we as an organization, as FENATRAD, together with the government that is leftist, requires and cannot avoid law. But we can do another one that can substitute it. Or even we have a campaign within the unions that it is to agree with the agreement 1989 that was implemented in Brazil. It should be implemented within the processes, etc. Those are our efforts. Those are the advances. And one of the advances is the empowerment of the workers on the level of Brazil and within the CONATRAD, because we have a lot of satisfaction in that sense, and that helps us to the household workers to be empowered. They should know what are their rights. That's the rights. And to listen to that, right? And to build, let's say, this way of slavery. And it's important to be aware of the patterns because that has been for so long. But we have been able to do it with the workers, household workers, to empower them and to have history that the entire society says that we're inferior. So with all of the studies and training, seminars, and all of those, we can make the worker to impose and to require the rights, to make them and give value to their work so that society um, values my work, the society needs to value the work, right? So she needs to demand this, right? That the society grows and to realize all of that mainly for herself. So the society will observe and will see you as anyone else. We want to understand and to be aware of that, right? And something that I said in the other panel is that in Brazil, we do not only have the right of 150, but within the 150, there's something that considers the rights, right? The help, the unemployment support for all of the workers, in this case, for the domestic workers or household workers, it's three. So we have to be aware of the rights. That is considered if you work 3 days a week. And the 189 says that everyone has rights. So once again, I'm gonna tell you, we need to consider the rights because a doctor has its rights. And he can go to the hospital every day. He has a license, right? And he goes to school and has all of the guaranteed rights. Why? The workers, household workers, are not guaranteed on their rights, working once or twice a day in the same house. So, twice a week, sorry. So that makes us realize that there's no equality in rights. But the truth is that the idea or the goal of FENATRAD is to make those rights equal. We have to demonstrate the society what we have for the public bodies and to be recognized and respected as any other worker. We have some advances and some situations with the government as our fighting plan. We have in the FENATRA the fighting plan, and that's where we requested studies and many other things. And well, we are being able to advance in some of them. We have, for example, the rights for every woman in Brazil, but we have specific one for the household workers. So those are some of the advances that we are obtaining with the fight, the continuous fight of FENATRAD within Brazil, with the government in this case, with the case of the current um, government. And it seems that our rights that were already conquered through what we had, they were gonna get back. And we know there that we had the opportunity to complete or to have the rights and not to allow the rights that we have already achieved to be lost. That's our daily life uh, fight. That's how we are obtaining and how we will obtain our goal to be recognized, respected as workers and as any other. My phrase is too repetitive, but that's what we want. And for that, we have to empower workers. In the pandemic, we had a phase that was very bad, but we used that ceiling to be able to empower workers. And we did a lot of online training with partners, right? And that made the household workers to be accepted as it is. And well, something that we should consider is them as any other category. That was an advance, but that's where there is a part of what the society um, demands from the household worker, that she's inferior with a low self-esteem. And if they don't consider, we're insisting in that situation and asking for reinforcement. So they continue re retracting until that is over. And that's it. That's what I think. That's something that we were able to achieve. As it is a tool, well, we have the rights and the human being is able to get more things over the system. There is a lot of household workers that with the social security, with paid social security, but without paying any fund. How they do it, I don't know. But well, it is a good tool. Nevertheless, pattern. The the employer, sorry, the employer is the one that should consider what also the unions are requiring. There's nothing that cannot be considered in the rights there they require from the employer, what they need specifically. And when the worker sees and gets to the union and there's no uh, same thing in the union, they can show with the signature and the rights that were not covered or were even eliminated, right? So there's also another situation that the employers do is that they have to sign their agreement and they tell you, I'm going to deposit here, and that money is never deposited. And how are they going to have a proof that that money was never deposited? That is going forward and backward on a certain way, right? But it is the guarantee that the union has all of the different documents, right? And there's something that should be considered in the union, and the worker was without help on a certain way, and many times have any like type of problems with her rights. That's everything that I have to say. I think it's a little bit of the situation that is happening here. Thank you. Thank you so much, Cleide, for all of the insights. We can continue with the Paraguay's colleague from the Union of Paraguay with the same questions. What are the advances in the enrollment to Social Security for the household workers? What are the main challenges or barriers that we have for the enrollment of the household workers, and what are the good practices for the implementation of the same? Without any further ado, you have the floor. Thank you so much. Thank you. Good afternoon. We have a delay with Social Security in Paraguay that the Ministry of Labor has the Act 569, and it has an act of half time, one day after the next one, and it's the Act 6,339. We do not have a Social Security because in our ad says that we can work partial time, half time, right? But our employers have to pay the minimum. That means if I have 3 employers, they have to divide to pay the minimum wage. And that partial time act, what it makes is that if I have 3 employers, they have to pay the 3 of them the minimum wage. That's why we are not being able to go forward. We have like a delay for us, and it has been very hard to have this law, this act. We fought a lot, more than 10 years, and we have now the act, but we are, well, we have everything. We have retirement, it covers health, but we do not have what we have. Like the problem is that the people from Social Security and us had an encounter. We gathered with them, but can you hear me? Yes. Yes. Yes, we are hearing you. I don't know if in the room. Yes. But well, we had a meeting with the people of Social Security where they do not agree with our requirements because they went with the Ministry of Labor, with the employers that fought for this law, and that made like a delay. That's where we are, well, delayed, right? The colleagues lost the social security instead of increasing it. Only 50% of the 200,000 household workers that are enrolled in Social Security lost the rights. That's why we shouldn't be like enrolled. That's why we have to consider mainly that they should implement the payment system, the payment that it is by 3 or 2 employers or one that is divided. But we are not able to achieve it. They want every employer to pay the minimum wage. So that is what in Paraguay is happening right now. So we are not good right now, and we have to start fighting with all of it, because the only problem that we have is that in Paraguay we have the act, we have retirement, we have all of the days paid off, right? And the 50% of the minimum wage, and now we are delayed with the Social Security. For us, domestic workers, it is very important Social Security because it covers also retirement. For example, I have been working in this for 30 years, and I have never had Social Security, and I'm never gonna be retired, a retired person. So many have that problem. And also the challenge that we have is that someday we can eliminate that act of partial time, and that will make things easier, would make us be able to retire, to have, so that will allow us to have coverage for health and, well, many more things. Third question was what, Polly? What I was listening, that Mr. Riquelme mentioned, is that we do not have oversight specifically, because they say that it is private and they cannot be able to get to that oversight. But in a company, they can do it, right? So we are not able to make the oversight for the household employment or as household employers, because you normally are 24 hours, well, in a job, right? We do not have daycare, or we do not have a plan for daycare here in Paraguay. That's why we have a lot of household workers that are with cama. That is a fight that we have been having for several years, right? How that means that they are requiring to be trained, that the children are safe in daycare, right? And make like a union specifically for the children of these ladies. So, and the challenges to be able to overcome, it's going to be a fight, a continuous fight, because after that we have everything, as I said, now we have a project of consularity to make a campaign in Congress to be able to see if we can eliminate that project of a half-time half-time act that is affecting all of the household, or part-time that is affecting all of the different household workers. I see that in Mexico they have the same problem and it is not complied, but the entire situation, all of the situations are the same worldwide. That's why there's not so much to adjust, because in Paraguay we are not covered. The fight is very slow and we are not being able to cover it. The state is not supporting us to see what is the problem of the household workers here in Paraguay. I think I still have 5 more minutes, right? We are also enrolled to COLATRAD. That's where we are always working, and all of the organization is, well, in the same problem, and we are all colleagues. The issue here is the social security, so that's why I'm telling you we do not have any type of social security. Thank you, Librada, for sharing with the audience, virtual and in person, to know what are the challenges that we have from the unions in the different places for the inclusion and incorporation of the household workers to the system of social security system. So I see that we do not have any questions. So we are open in the section. We'll have a section for Q&A for the panelists. You can send the questions through the chat, or if you want, you can make a question. Turn on your microphone. Ask a question. Thank you. Do we have any questions here? Oh, we have one that it says that in Paraguay, how a household worker works 3 days without social security and the rest of the benefits. Librada, if you're with us, can you answer this question? Well, the truth is that we have great need in Paraguay. As you know, as a household worker, the first concern that we have is to have a job. So that's why the employers take advantage of the employees as household workers without social security. Many women are discriminated, and well, they are trying to help us, but on the Ministry of Labor, they haven't given us any type of social security. Thank you so much, Librada, for that information. Let's now give the floor for a person that has a question from in social media. Go ahead. Sorry, in person. Thank you. Well, my name is Francisca of CACEH-Nacional. My question is a question. You were saying that in this sector of household workers, they had social security and there was like a backlog where they eliminated the benefit. Was the argument to take off that benefit? Well, the Ministry of Labor, the director made the law, the Part-Time Act. And as I mentioned, the part-time, as they take it from the Social Security, because an employer has to pay the minimum, and it means if I have three employers, they have to pay the minimum. And what we're requiring for the Social Security and the people of the ministry, we had three parties that should eliminate that act, that is called 629, that was created in 2019. I think it has a difference from the full-time act, right? And this part-time labor act is being bad for us because we have an act that is called 5,407 that made these household workers to be to have less. Instead of going and advancing and going forward, we are having less. So that's why, because we have a need and we work without social security. Thank you. Thank you so much. Librada. I don't know if it answered your question, but here mm, we have another question from Cleide, for Cleide, that since when there's a requirement of like a standardization in the union and from where it is starting.
Can you hear me now? Well, this is a retrospective. I think it was the previous government where we had a work form that limited the union homologation. What we're trying to do is to go back with the argument that workers uh, are jeopardizing. So now it is very difficult to do the oversight. So how can they prove that they have not received this right? So I think it was in the workway, I think in the previous government, the one that removed the obligation to do a union homologation. Thank you so much. We have another comment or question here again for Cleide. I would like to Cleide to expand on the unions about the IME for workers in Brazil. So, of course, could you repeat the question because I don't think I understood. So the question is, I would like to ask Claire if she could expand on the opinion of unions about the IME for workers in Brazil. To Cleide. Or if the person that made the question can expand. I'm going to go to a presentation. Now I understand. So yes, so this, thank you so much. Yes, because I was not understanding. I'm sorry. So specifically, we have nothing against MIE. The MIE is micro individual entrepreneurs. So the person is a company, he's creating a micro company, an SME. So within domestic work, it's not okay because they don't have an employer. They work for a person, but it's not an employer. So that's against what I mentioned. So if a physician has rights, professors have rights, and domestic workers are working there every week in the same house, they have to arrive at certain time, they have to do some activities. For me, this is a right. And I don't say that we don't talk about equal rights, but it has to do with other workers. So I think 90% of the workers here in Brazil, of the workers, domestic workers, are semi-alphabets or are more, they're have no literacy or they're over 60 years old. So these give us some gaps that make them or to cause them to be in the credit bureau because they cannot pay the contributions because these are things they don't understand. And this is a problem. I'm not in favor of SMEs for domestic work. And thank you for the person that asked the question because I forgot this detail. And how do you organize workers in order to obtain their rights for the Paraguayan presenter? Can you hear me okay? In Paraguay, yes, we hear you, but it's very soft. So let me try to increase the volume. In Paraguay, we organize ourselves according to the unions. We are almost 400 kilometers away from the capital, where we're always gathered with our peers from Asuncion. We travel, and that's how we are making plans on how to fight. And that, as I said to you, we're able to have this law, but without complying with that. And through the union, domestic workers, we do we ensure that the right of workers, domestic workers, are met. And we had, for example, lots of problems because we didn't pay like a Christmas bonus or we gave vacations through the union. We always provide a follow up with the peers and we go to the Ministry of Workers to go with them. And thank you so much. And so we have another question for Cleide. So this system is a deconstruction of our fights because they deny Social Security. It's you are in mute, Cleide. Can you turn your microphone on? Mm. So, Eli Garachi, we have to change Social Security. However, it removes from workers this category and it removes this warranty of the other rights of vacation, Christmas bonus, vacation. So when you see domestic work as being your own employer, so practically they remove this category of worker when you are a person that works on a day-to-day, a person that works on a day-to-day basis. They can pay their CNSS, and with that, they continue with the category. And with that, they there they would continue with that category. So it would be on that. I don't know if I answered your question. I think that we don't have any other questions here in the face-to-face, so we're going to thank each and every one of our panelists for their fantastic positions. And on this, that is a forum on the basic work, and for all of Latin America. And we are going to allow to continue with the next panel in a few more moments. We'll be with you again, reintegrating with each and every one of you. I wanted to thank each of the panelists. I don't know if you have any final words to close this panel and then go to the next panel. We're going for more. I cannot hear you. You have to get closer. We're going for more, my dear peers. Can you hear me? Yes, now we can hear you, Librana. We're going for more peers. Thank you. Thank you so much, Claire. I wanted, before I thank you for the panelists, I forgot to mention another reform of the intermittent work where you can work a few hours, not the full day, but they could pay you this right. So the money that the minimum wage has a discount, but the worker has no problem. So we have progress here because there's oversight. Now it is not necessary to have previous mandate. So now you can prove, you can go to the home, you can rescue workers, even if many are trying to revert this, not to comply with the law. So I would like to thank you very much because it's very important that this space and this exchange of experiences, this is important. What we do not have in Brazil, you can have it in other countries, and we could look to improve or to ensure or look to ensure the law is complied with. And I love this statement. We still will still see our category being respected as a category. There's a fight for equality of rights. I think this is an ongoing fight of all the different countries and all the different guidelines of domestic workers. That is a category like any other. Thank you so much. Thank you so much to our panelists for your fabulous presentations regarding acceleration to Social Security, the important challenges that unions and organizations have that defend the rights of household workers in each of these countries, in Mexico, Brazil, as Paraguay, as well as the rest of the region, that is not less than the problems are the same for each of the countries affiliated to our organization. And I wanted to thank you today, and we're going to close this forum. Tomorrow we'll continue with the continuity workshops. And I wanted to request from the panelists and all the people that are online, if you could open up your cameras so we can take a picture, a closing picture, and in the first day of the household work and Social Security. You can check today's forum in the YouTube channel of Assis and Case. Thank you so much.
Muchas gracias.
Thank you so much.